Okay, my name is Dr. David Hall. I'm the president of Infinity Dental Web and an accredited cosmetic dentist. And I've assembled a group here of three other accredited cosmetic dentists to discuss the value of the accreditation. I have here Dr. Marilyn Calvo, who is a board member of the American Board of Cosmetic Dentistry, which is the credentialing organization that decides the accreditation standards and administers that program. I have Dr. Mike Malone from Louisiana. Dr. Calvo, by the way, is from the Los Angeles area. Dr. Mike Malone from Louisiana, who is past president of the American Academy of Cosmetic Dentistry. And Dr. Mike Zarek from the Boston area, who is currently the president of the New England Academy of Cosmetic Dentistry. So let's start with you, Dr. Zarek, and tell us about the American Academy of Cosmetic Dentistry.
Sure, Dave. It's a 30-year organization that's providing educational courses along with accreditation and fellowship postgraduate programs for their member dentists. Okay,
very good. And Mike Malone, why did the AACD start an accreditation program?
Well, even back in the mid-'80s, when the AACD was started, the founders realized that the average consumer out there had no way of knowing when they were trying to choose a cosmetic dentist whether that dentist had the experience and the knowledge to perform really at a high level. So they felt that starting an accreditation program would give the public a way to choose a credentialed dentist. Just like if you were to go to a plastic surgeon, you're going to look for a plastic surgeon that is certified by a credentialing board.
Very good. And then Dr. Calvo, so what is involved? You administer this exam. What's involved in the accreditation exam?
So first of all, accreditation sets the bar for excellence in cosmetic dentistry. So this accreditation process is set up with 3 different examinations. The first one's a written exam. The second one is 5 specific cases. The first one being a smile makeover done with porcelain restorations, porcelain veneers, porcelain crowns. And the final facet of the examination is an oral exam. It's a difficult process, but achievable if you persevere.
Okay, what's the rate? How many dentists pass it? What's the pass-fail rate ratio?
It's different amounts every year, every clinical process. So it's been going up every year.
Okay, but a lot of dentists fail, don't they?
As some of the dentists learn the protocol of what's expected of them and what's in the realm of excellence, their skills develop, they take the continuing education classes necessary, and they pass.
Okay. Very good. And let's one more question for you, Dr. Calvo. A view I hear from some dentists is that any dentist who graduates from dental school can do cosmetic dentistry. They're all given those skills. Could you comment on that?
Well, from the work that I've seen, many dentists think that after they graduate from dental school and have been in practice for a few years, they can do cosmetic dentistry. But when they start the accreditation process, they see the level of excellence that's required, and many have to take more continuing education classes and develop their artistic skills to be able to pass accreditation.
Yes, it's, you know, a thought process that governs the dental school education. It's more of an engineering curriculum. It teaches them the techniques to do dentistry that lasts, but there's no art really in the dental school curriculum.
Well, I think that's how it is in a lot of professional schools, that when you expand your skills to the next level, that's something that you're going to have to learn on your own.
Mm-hmm. Okay, so Dr. Malone, how much of your work is involved in redoing other dentists' cosmetic dentistry?
Well, David, for the last 8 to 10 years, I've I've limited my practice to only cosmetic dentistry. So I probably see around 30% of my cases are failed cosmetic cases, and the vast majority of those fail because the treating dentist just doesn't have the skills in doing complex smile makeovers. Most dentists, when they're especially younger and right out of school, they may be good at doing 1 or 2 or 3 teeth, but when it comes to putting together an artistic makeover, they just don't have the training.
Okay, and then finally, Dr. Zarek, so how does accreditation then, in summary, assure the patient?
Sure. Whereas dental school just provides the technical skills needed to achieve minimal cosmetic dentistry, going through the accreditation program really teaches you the art of smile design, and you have to demonstrate the proficiency in that by submitting all the cases that Malone had talked about to be reviewed by the peers.
Okay, very good. Well, thank you all for participating here, and hopefully we provided some helpful information to people if they're looking for a smile makeover. Look for an accredited cosmetic dentist. That way you know that this is going to turn out right and you're going to be happy with the result. Thank you all.